last two speakers crushed it.
You crushed it. So, many thanks to the hundreds of dedicated professionals and staff at Mission who are working right now in this very difficult situation and horrible conditions. I've been a nurse for 45 years, of which 37 years were working in large tertiary care referral centers in Virginia and North Carolina. My time in hospitals included critical care, med-surg, case management, clinical informatics, and nursing administration. For 15 years, I've also worked as a contract educator for the North Carolina Board of Nursing, helping disciplined nurses take the mandatory legal ethical decision-making course when they made life-changing mistakes. Nurses make catastrophic career-ending mistakes when they are stressed out at home or when they're stressed out at work. In North Carolina, registered nurses are held accountable to 4 pillars of practice: the North Carolina Nurse Practice Act. Number 2, the American Nurses Association Code of Ethics. Number 3, the Patient Bill of Rights for each specific hospital. Number 4, standards of practice for clinical performance in specific units for similar size, similar service hospitals. Nurses working in hospitals become most stressed when they are short-staffed. Short-staffing means that the acuity of the assigned patient load is too high, or the volume of patients to whom they are assigned is too large, or both reasons. When there is chronic short-staffing or not enough staff on a unit for days, or months, or years, nurses become very tired, stressed, and overwhelmed. Nurses succumb to something called moral injury. So moral injury is a deep soul wound that pierces a person's identity, sense of morality, and relationship to society. And working in short-staffing situations routinely, day after day, are also called routine, incessant betrayals of patient care and trust, and are examples of death by 1,000 cuts. So we have nurses and physicians and many people working with death by 1,000 cuts. When there is ongoing staffing shortages each day for a nurse, he or she feels as if they are not able to adhere to their nursing practice standards as defined by the North Carolina Nurse Practice Act. They might say, I'm violating my practice act and I'm leaving because I can't give the right nursing care to each patient. I am putting my license in jeopardy. No nurse wants to lose their license. This means they might have a loss of income, an inability to take care of their families, and provide for food and housing. Nurses are leaving because of chronic staffing shortages at Mission. I started my own practice as an RN patient advocate, a holistic RN patient advocate, to help patients and families navigate our dysfunctional, silo-driven, technologically impossible healthcare system with less stress and more peace of mind. I have worked in this role for the last 8 years. I also became a board-certified nurse coach to help nurses who were disciplined find their way back to nursing with peace, acceptance, and purpose without shame or guilt or negativity. If we want to make changes in our healthcare system, and which is delivered at HCA Hospital, we all must become advocates. We all must become advocates in this room. A patient advocate is someone who stands up and speaks on behalf of a patient or family. If we do not speak up, someone else may or will be making decisions for us. When should we speak up as an advocate? When there is concern, harm to a patient or family in a hospital. HCA is the first and only hospital in which I have ever worked that has 9 immediate jeopardy issues regarding patient harm or deaths as issued by the Department of Health and Human Services. All of our voices in this region must be the tools we choose to report these unacceptable patient outcomes. What are the takeaways? What are the things I want you to know? You must always advocate for yourself or loved one for health care at Mission Hospital. Always have a second person, number 2, always have a second person to act as your advocate in the hospital, in the room with a notebook to document your health care, and when asking for help from hospital staff. This person can be a family member, a friend, a neighbor, or a professional advocate. Number 3, obtain a copy of your medical records, which is your source of truth for what happened to you in that hospital. Number 4, call the North Carolina Division of Healthcare Complaint and Investigation for all patient care complaints that are confidential. That number is listed on this resource. I have this number in my phone, and I send it to patients. I also volunteer to go with patients to sit in together, and I will be their voice while they add or want to talk to the person on the phone. And 5th is to call the Asheville Watchdog for confidential stories and complaints. I have referred a lot of patients to the Watchdog, but only asking their permission, but Watchdog serves as a voice for them. And in conclusion, now I'm addressing any retired nurses in this room. I am forming a Western North Carolina Retired Nurse Corps. If you are interested in learning to advocate for patients and families and retired nurses, please see this person on the front row, Kay,